part 2 of our talk with Professor Satpathy. We are going to be talking about his other project, wherein he led the team of researchers to develop COVID-19 screening or testing booth. This testing booth eliminates the use of these costly PPE kits and also prevents the healthcare workers to come in close contact with the patients of COVID-19 or the people that they are testing for COVID-19. So welcome to the show once again, Professor Satpathy. Would you like to elaborate more on that?
Yeah, Anushi, it's actually my pleasure to talk about the COVID booth, which my team was able to do it recently, and which I believe is some kind of societal innovations. The COVID screening booth idea is not very new. Obviously, South Korea made this kind of screening booth for screening the corona patient. In India, also, in some other states, including Kerala and Rajasthan, they have been using this. So we have also inspired by this idea, and we made some modification in the design, and we came across this COVID screening booth. So our COVID screening booth is unique in some sense. So if I start from the beginning, as we know that the frontline workers, like the health workers, who has to screen the lots of COVID patients regularly, they are susceptible to get infected very soon. And we don't have a lot of good supply of the PPE kit. And as you know that PPE kit are quite costly. And after screening every patient, it is required to replace those PPE kit. So obviously there is a need to develop a low-cost portable system for our medical professionals or for healthcare professionals will be able to screen a large number of people. And also we believe that the success of the corona eradication will also depend upon how many patients you can screen from any zone or from any area. So it is very, very important that you screen or you test as many people as possible in one single day. So that was the inspiration behind this designing. So what we have done, we have just used a similar concept like a telephone booth. And here, the frame of the telephone booth consists of a metal, and the front surface of the telephone booth is made of a special kind of glass. It's called acrylic glass. And right now, we have made use of some kind of antiviral coating on the top of this acrylic sheet. And there are two gloves which is inbuilt inside this acrylic sheet, and the healthcare professional, as you have seen in the photo, they stand inside this booth and they can extend their hand through the gloves to the outside. The patient comes from the front side, and then the swab sample is collected by a earbud or something, and then it is kept inside a specially designed container outside the chamber, and then finally it has been transferred by the green zone to higher center for the further testing. Now there are specially designed UVC light which is inside this chamber, which helps to disinfect any kind of potential bacteria or virus when the doctor is not inside this chamber. And there is also a exhaust fan has been inbuilt inside the chamber. And after each use, we advise the gloves and the front surface should be sanitized before coming to the next patient. So by using this kind of screening booth, we are able to screen many number of patients without even using the PPE kit daily basis. So these have been used in the Haridwar district in almost every hospital. Right now, we are in Roorkee Civil Hospital. They have been used it regularly, and 20 such booths has been installed at different public places and in medical hospital in Haridwar district in Uttarakhand also.
Are you also going to collaborate with any manufacturers to manufacture these in larger quantities?
Yeah, so since we have introduced some new kind of design concept here, so we wish to file a patent on this idea. So once the patent filing process will be complete, then we are going to collaborate with the manufacturer. Right now, we are collaborating with our Roorkee Nagar Nigam for making this booth, because we cannot make the booth in IIT in a large quantity. But our concept is that once we will be able to file a patent, then we are going for a mass production, we are going to collaborate with any company. And I like to bring your attention that in this line, we are also doing a frontline research on different other things related to the coronavirus. For example, we are right now in the process of development of a corona disinfectant box, which we'll be able to bring in the market very soon. We are also working on some antiviral mask, which I will be able to update you very soon, within a week or so.
Professor Satpathy, how difficult was it for you to work on this project, considering the lockdown, sourcing the raw materials, working with your other team members, etc.?
Oh yeah, I mean that is quite a difficult task, and thanks to my team, like who are sitting here. Although during the lockdown, like all of us has worked day and night, and I also like to thank the Roorkee Nagar Nigam, who has helped the necessary administrative support during the lockdown period. Without that, it was quite extremely difficult to work on these projects, especially getting the raw materials and getting carpenters or electricians who will complete the design and all these things. So I mean, it was a group effort by all of these people.
Any message that you have for the young innovators across the country?
Yeah, I believe the entrepreneurships should be from the grassroots level. We have to innovate. We cannot depend on everything from outside country. And I believe that these young engineers in our country have the potential to innovate some design or new idea or new concept. But the fact is that coming from the concept to materialize those ideas, there is always a barrier, and we have to cross that barrier. For that, we have to motivate ourselves. There are a lot of other kind of helps are available. So nowadays, doing startup or bringing the idea from the conceptualization stage to the market is not that much difficult. To be proactive, but the future is very, very good, and I think that this coronavirus also give us an opportunity to become self-independent. And thanks to my team, who are sitting here. Although during the lockdown, like all of us has worked day and night, and I also like to thank the Roorkee Nagar Nigam, who has helped the necessary administrative support during the lockdown period. Without that, it was quite extremely difficult to work on these projects, especially getting the raw materials and getting carpenters or electricians who will complete the design and all these things. So I mean, it was a group effort by all of these people.
Thank you, Professor Satpathy, for taking out precious time to be with us.
Okay.
Thank you so much.
It is all our pleasure to be here and to talk to you people. Thank you.